feels like minus 40, in fact, even minus 50 in some parts of the prairies. Now, that kind of extreme cold can put people at a very real risk of frostbite, and that's something that can happen in minutes, particularly for children and the elderly. They're particularly vulnerable, and people who don't cover up properly. So we want to give you a prevention guide this morning. Dr. Karl is here, our medical specialist via Skype in Toronto. Great to see you. I'm glad you're warm as we tackle this cold topic today. What temperatures are we concerned about? We're talking minus 40, minus 50. What temperatures are we concerned about for frostbite, Dr. Karl?
Well, when the wind chills start to get even as high as just, let's say, minus 28 to, minus 30 in that area, that's when the risk begins. And at that level of wind chill, you can start to see skin freezing in 10 minutes, 20 minutes, 30 minutes. So it's not always so much the ambient temperature, but that wind chill that really takes heat away from the body and puts it at risk of freezing. And that's basically what frostbite is.
And you're talking about how quickly it can happen in a matter of minutes. Are there any body parts that are considered more vulnerable than others?
Well, in general, I mean, any body part that's exposed could theoretically freeze and become frostbitten. But in general, we talk about those extremities, those parts of the body that stick out, that have less blood supply. So we talk about ears, nose, fingers, and toes, and so it's important to keep those covered up and well warmed.
Okay, we'll talk about prevention in just a second, but let's go through the warning signs. What should people watch for in terms of symptoms? And we have some graphics here to back up what you're going to say. What are the warning signs people should look out for?
Well, there's basically 3 stages that we talk about. So in the first stage, what we call frost nip, not frostbite, but frost nip, you have the superficial layers of the skin involved, and you tend to get redness. The skin becomes inflamed. You may feel either some numbness or some tingliness or itchiness in the skin. As the freezing progresses, we get into the second stage, which is sort of mild or superficial frostbite. And that's where you get the upper level, the epidermis and the dermis, which is the tissue just under the dead part of the skin. And in those cases, you're starting to see ice crystals forming in the tissue. When that tissue then warms up, you may get blisters, you may start to feel pain, and the skin begins to turn white. In deeper frostbite, the third stage, that's when you start to get down into tissues below the skin. So it may get into joints, muscle, bone, and at that point, the flesh may begin to die. So you may start to see blackening of that tissue. And again, you may have the pain and the numbness that goes along with it.
And if you do notice those symptoms, what do you do?
Well, the first thing you want to do is try to get yourself or whoever is frostbitten out of the cold conditions. So if you can get indoors, that would be the best thing. And if you can't, to begin to rewarm the tissue as much as you can by wrapping it if it's exposed. One trick is to put if it's your hands, for example, to put it under your armpits, or put it against somebody else's body so that you can start to rewarm it. One thing you should not do is rub it. Some people think rubbing it will get the circulation going, but you can imagine if the tissue is frozen and there are crystals in there, rubbing it can start to cause more damage. And certainly don't rub snow on it. So you're trying to rewarm it. And if you notice that there's a change in the coloration of the skin, get medical attention as soon as possible.
Okay, that's important advice. But listen, Canadians, hardy folk that we are, we like to be outside even when it's cold. Some of us, our jobs take us outside. We have to be outside. So to prevent frostbite, what's the advice for avoiding that in the first place?
Well, you want to hopefully be able to take breaks going inside from time to time to warm up again. But dressing in layers is important. Covering up any exposed skin is important. Having warm, dry clothing, and dry is key because if it's wet, you may lose more heat. And moving around is helpful to keep the circulation going. Also, you want to avoid alcohol. It may make you feel warm in the short term, but what it actually ends up doing is allowing your body to release heat, and that's the last thing you want to do.
Okay, thank you so much. Valuable information for all of us in the country, but today, Dr. Karl, particularly for the folks in the West. Thanks a lot for joining us with that, the Frostbite Guide. Now listen, as cold as it is, and